Good afternoon, everyone. This is Dr. Bhupesh from Dr. BKM Institute. This is a kind of a role play we haven't done before, in which a lady or a man who has undergone total knee replacement underwent a left total knee replacement 3 weeks ago. So it has been 3 weeks. He underwent a hip replacement. At that time of the discharge, the patient was advised to use walker for his or her activities of daily living and ensure compliance with physical therapy at home. So the patient has been discharged after the knee replacement 3 weeks ago. After getting discharged, he was advised to use walker of daily living and ensure compliance with the physical therapy at home until his or her follow-up appointment scheduled next month. So basically the appointment have been scheduled for next month and he has been advised to use walker. But let's see what's the problem with the patient. So her spouse called the hospital today and explained that she is not using his walker since last evening. So basically after 3 weeks of surgery, the patient has stopped मतलब present perfect. Present perfect का मतलब उसने छोड़ दिया है वॉकर को यूज करना. So always हमेशा please make it sure that you are using the right words so that everybody can understand in a nice way. So आपको भी अपने मन में ऐसे बोलना चाहिए has stopped का मतलब present perfect यानी कि छोड़ दिया है. So has stopped using the walker since last evening. The spouse is concerned about her hurting her knee. और spouse को पता है कि knee replacement हुई है तो उसकी knee hurt हो सकती है and has asked you to visit the patient at their house. So you are going to the house of the patient. During your visit today, you also notice, this word is very special in today's speaking, that you also notice, that हमने भी notice किया that patient is not using a walker to walk around the house. So basically patient use नहीं कर रहा है. Find out why the patient is refusing to use a walker. So वो बहुत सारे excuses बना सकती है, मैं walker इसलिए use नहीं कर रही, उसलिए use नहीं कर रही. तो आपको ये पता लगाना है. Educate the patient on importance of using a walker for his or recovery to help his balance. तो उसको बताओ कि बैलेंस के लिए बहुत जरूरी है. एंड पुटिंग लेस वेट ऑन द ऑपरेटेड नी. और जो भी ऑपरेटेड नी है उसके ऊपर आप ज्यादा वेट नहीं कर सकते क्योंकि आपकी मसल्स अभी वीक हैं. So by the time your muscles will recover, then you would regain your strength. When your muscles will recover, future में will, when your muscles will recover, you will regain strength. आप कर लोगे. लेकिन अभी के लिए it's important. Persuade the patient to use a walker until his or follow-up appointment. So we have to persuade the patient that he has to use the walker जब तक उसकी follow-up appointment नहीं हो, which is ये यहाँ पे clear नहीं है, next month. So maybe after a week भी हो सकती है, लेकिन यहाँ पे अच्छे से दिया नहीं है. तो हम इस कोशिश करेंगे इसको ना बोले next month, हम यही बोलेंगे until your next follow-up appointment. Explain the risk involved if she does not use the walker. तो अगर कोई रिस्क यही है कि if you will not use the walker, then आपकी नी को रिकवरी में और हीलिंग में प्रॉब्लम हो सकती है. और अगर आपको हीलिंग डिलेड होगी तो आपका ही नुकसान है. सो हीलिंग कैन बी डिलेड. अब देखो, अगर मैं पॉजिटिव पॉइंट्स आपको अलग से लिख के दिखाऊं फॉर द टास्क, तो हमेशा पेपर में आपको पता है आपको 3 मिनट्स मिलेंगे प्रिपेयर करने के लिए. वैसे तो वहां पे क्वेश्चन पेपर पे आपको क्वेश्चन पेपर पे लिखना है. जैसे आपका ये रोल प्ले, आपको 3 मिनट्स मिलेंगे प्रिपेयर करने के लिए. तो फर्स्ट लाइन मैंने आपको हमेशा बोली है, लिखे करो हाय, सॉरी हाय नहीं बोलना, गुड मॉर्निंग. ओके सबसे पहले फर्स्ट लाइन पेपर में लिखनी है. जब ये 3 मिनट्स रोल प्ले आपको प्रिपेयर करने को मिलेगा, आपको तब तक इसको लिखना है. आई एम, आपका नाम, आई एम हियर एंड आई एम हियर, फ्लो में, एंड आई एम हियर टू आस्क यू अबाउट योर प्रोग्रेस. सो हाउ आर यू फीलिंग नाउ. देखो कितना सिंपल टास्क हो गया. इसको पहले लिख दो, फिर उसके बाद आपकी स्पीकिंग आराम से चलती रहेगी, क्योंकि ये लाइन लिखनी जरूरी है. आप सबको लगेगा कि कोई बात नहीं मैं बोल लूंगी, लेकिन फिर आप गलत बोलोगे. इससे अच्छा देख के ही बोलना. जैसे गुड मॉर्निंग, आई एम भूपेश एंड आई एम हियर टू आस्क यू अबाउट योर प्रोग्रेस. सो हाउ आर यू फीलिंग नाउ. बिल्कुल फ्लो में बोलना. ऐसे मत बोलना कि रट्टा मार रहे हो कि गुड मॉर्निंग आई एम हियर एंड आई एम हियर टू आस्क यू. आराम से गुड मॉर्निंग, आई एम भूपेश एंड आई एम हियर टू आस्क यू अबाउट योर प्रोग्रेस. सो कुड यू प्लीज टेल मी हाउ आर यू फीलिंग नाउ. फिर पेशेंट आएगा, आई एम फीलिंग वेरी गुड, योर डॉक्टर्स आर वेरी नाइस, this and that, I'm very happy, my knee is healing well, I have followed all the regimes, I have got physical therapies at home, and now I am feeling better. Okay, that's nice to hear. फिर उसको को okay, वो अगली लाइन, this is nice, that's nice to hear, yeah it is nice to hear that, it is nice to hear this. अब उससे पूछो but, अब आप पॉजिटिव बात करके अब आप नेगेटिव बात करो, बट कुड यू प्लीज टेल मी व्हाई आर यू नॉट यूजिंग यूर वॉकर। तो उससे पूछो कि आप अपना वॉकर क्यों नहीं यूज कर रहे, तो ये लाइन पहले ही लिख दो। सो आप जितना लिखते रहोगे आपका टास्क इजी होता रहेगा। तो पेशेंट बताएगा आपका पहला टास्क पूरा हो गया कि वॉकर क्यों नहीं यूज कर रही है। सेकंड टास्क दिया है एंश्योर दैट पेशेंट ऑन द इम्पोर्टेंस ऑफ वॉकर एंड हिज रिकवरी। तो उसको जब वो बहाना मारेगी तो उसको कहना है प्लीज अंडरस्टैंड, ये वर्ड बोलना है, तो पहले लिख दो प्लीज अंडरस्टैंड इट। वॉकर वॉकर जो भी वर्ड है इज वेरी इंपॉर्टेंट फॉर यू। क्यों एज लगाओ, एज इट हेल्प्स यू टू बैलेंस, आपका बैलेंस बढ़ाता है, जो दिया है वही, इट हेल्प्स यू टू बैलेंस यहीं से। एंड मैं आपको थोड़ा सा ऊपर कर देता हूँ, इट हेल्प्स यू टू इम्प्रूव योर बैलेंस एंड ऑल्सो इट हेल्प्स इन पुटिंग लेस वेट। तो ये थोड़ी सी लाइन मुश्किल होती है, वैसे मुश्किल नहीं है ऑफकोर्स जिनको इंग्लिश आती है। इट हेल्प्स इन पुटिंग लेस वेट ऑन योर नीज। बस अब आपकी ये भी लाइन तैयार हो गई है। सो एवरी लाइन इज ऑलमोस्ट रेडी। उसके बाद परसुएड द पेशेंट टू यूज द वॉकर until the follow-up appointment को only doctor can advise you to stop using it, yeah, to stop using it, to stop using the walker. So please do not do it by yourself। तो कितना आसान है, प्लीज डू नॉट डू इट बाय योरसेल्फ, अपने आप मत करो। यही चीजें देखो कितनी सिंपल लाइन, अब मैं आपको बोल के दिखाता हूँ, बिल्कुल सेम बोलूंगा, आप प्लीज मेरे टास्क को ही पढ़ना और जो मैंने बनाया उसको ही पढ़ना। Good morning, I am Bhupesh and I am here to ask you about your progress. So could you please tell me how are you feeling now? Well, nurse, I am feeling much better. Well, I am glad to hear that. So are you facing any problem? Well, no, nurse, I am not facing any problem. Rather, I am ecstatic that your doctors are very nice. My knee has healed well and it has been 3 weeks. I have followed all the protocols and I am feeling much better. Well, I am glad to hear that you are following all the protocols and you have followed the protocols until now. But what I have observed after coming to your home is that I can see that you are not using your walker. So could you please tell me why are you not using your walker? Well, nurse, see, as you know that I have recovered completely. So why should I use a walker? Well, I do understand what you are trying to say, but I would like to advise you that in cases like these, when healing is not proper, it appears to the patient that healing has is complete, but in fact healing is not complete, you are still in the recovery phase. Yes, you are feeling better now, but if you will not use the wheelie walker, your recovery will not be complete. So for your complete recovery, it is imperative, it is necessary for you to use the wheelie walker. Have you understood? Well, nurse, no, I have not understood. I don't want to understand. When my recovery is well, you are behaving same like my husband. He has scolded you, and that's why you are here. But why don't you understand? I am feeling better. That's good that you are feeling better. We are very glad to know that you are doing very well. But at the same time, I would like to tell you and like to explain you again that it might appear to you that you have recovered, but in fact, you have not recovered completely, because after the knee replacement the muscles are still very weak, and in your case also your operated knee is very weak and the muscles around it are very weak. So if you will put more weight on this, it will become very comfortable. Also, I would like to tell you about the importance of walker. So walker helps you to maintain the balance and also it helps you in putting less weight. As I have already told you that you are having weakened muscles, so at that time, it is very important to put less weight on your operated knee. So please understand this walker is very important at the moment. Nurse, why don't you understand? You know, I feel old. I feel psychologically disabled whenever I use the walker. So the problem is that when I use the walker, it makes me feel 10 years older and that hampers my recovery. That is what is the problem. Okay. So I have well understood your condition. I totally understand what you are trying to say, that you feel old psychologically as well as otherwise when you use the walker. But please understand, this is very temporary. This is only for the next 2 or 3 weeks you need to use the walker. It is until your next appointment only that you have to use the walker. After your appointment, if doctor feels that your knee has completely healed and you have recovered completely, then there is no use of wheeling the walker. It is not a permanent thing. Please understand, my dear, it is not a permanent thing. It is very temporary and it is for the time being that you have to use it. till the time you have your complete recovery. So from outside and otherwise it might appear to you that you have recovered, but in knee surgeries after this knee replacement, it always takes around 1.5 months, and in your case it has only been 3 weeks. So please don't try to rush, otherwise things can become spoiled. Okay, nurse, but you have really discouraged me. I did not like your counseling. Well, I am sorry, but whatever is truth, I am saying all these things for your benefit, and it is a complete truth that after the knee replacement, it is important to use the walkers for like 1.5 months or so, or until the next appointment with the doctor. And it is applicable for all the people, and especially when you are around 64. So at this time you should be more careful, as the recovery would be slower. Please understand, if doctor has recommended for 1.5 month, so you should follow doctor's instruction. All right, nurse. Okay, I will try. Well, thank you very much for understanding and for your cooperation, because it is really important for you and this will benefit you only. And last thing again, I would like to tell you, please understand that if you will not do that, the risk is really high, and also, you can spoil your knee. So please understand, if you want to recover quickly, following the doctor's instruction is very important. I hope you have understood. Well, yes, nurse. Okay, that's great. I'm happy. So I'm leaving now. And if you have any problem, here is the leaflet. Please read the instructions of the leaflet. It contains the information of taking care of yourself after the knee replacement. And for 6 weeks, you should follow these instructions. And then doctor will have your appointment. When you will visit, doctor will tell you that whether you can stop using the walker or not. Is it okay? Well, that's fine, nurse. Well, that's great. Okay, then I am leaving. If you have any problem, there is a number on the leaflet. You can ring on that number anytime. Thank you and take care. Okay, nurse. Thank you so much. So this is how you execute your role play. So I'm just gonna unmute you quickly to ask you for any doubts you may have, because there are many new students who have joined. So I would like to ask you all that, if is there anything, any doubt that you may have with you, please ask freely. Any doubt, please. Any doubt?
Mhm.
Is it all good? All good for everyone? Okay, then I'm
Yes.
stopping the recording for now. And then what I'm going to do, I'm still going to ask you for any doubts. Okay, this is Dr. Bhupesh from Dr. BKM Institutes. And our contact number is 76967 34256. Thank you.